everyone, this is Dr. Sanders here from Integrated Health Solutions with another tip of if you have pain in this area, this is what you can do. Back pain is a very common condition that nearly every individual may experience it directly or indirectly in their lives. And it has a myriad of things that cause or contribute to it. If you specifically have pain in this area here, depicted here, it could be coming from a myriad of places. One place that's often not noted or known is from the hip or glute muscles, particularly these muscles here. These muscles primarily have a couple of responsibilities. One is they help engage in hip extension and external rotation, which is very needed for walking, squatting, getting up and down, and running, anything that's related to those kind of things. So we use it every day. We also do a fair amount of sitting on these muscles. A lot of times, if we do a lot of sitting, hip flexor muscles here can become tight or shortened, causing our pelvic to tilt forward. In that scenario, when we choose to sit down in there can be an added tension along the back part of the glute area and in the hamstrings. And then sitting there all day long can cause increased tension on that already stretched out muscle. And then having it to go and extend the hip and externally rotate the leg with that forward tilted posture further can aggravate that muscle and cause one of the areas that causes pain is in that area, but also it can refer to the low back. So if you're having low back pain, it may be coming, and find yourself doing a fair amount of sitting, it may be coming from that gluteus medius muscle. And today I want to show you something that you can do to help release the tension or decrease the reactive nature of that muscle. Now, a couple of different rules with regards to rolling that are important for you to know is, one, if you can't get in the positions, or if there is a drastic increase of pain by just getting in the positions, this exercise is you're not ready for it. This one is more of a moderate to advanced level of releasing tension, but it is very effective in inducing just the amount of stress in that area to calm that muscle down, to calm the mind down from being reactive to stress in that muscle. So you need a foam roller. With the foam roller, again, we're targeting these muscles here. You start by merely just sitting on the foam roller like this. This kind of gets you in the right position. And when you're ready, this arm comes behind the foam roller. The leg that's closer to the ground is brought up on top of the leg that's on the ground here. You can have your feet flat on the ground, and then these other hands can brace on the ground. You can target certain areas of the muscle, and then you simply just roll over that muscle. Try it again from this position here. Again, start laying on the foam roller. Arm comes behind the foam roller. This leg becomes straightened. Bring this leg on top of that leg. Arms here. You can put it on the ground or support the leg. And you're just going to roll right over that muscle. And you'll find it there a couple of times. A good 15 to 30 seconds in this area with this technique is going to be plenty to help release tension in those glute medius muscles. So if you have active symptoms in the area, here's a good general rule of thumb. You start off rolling, so you can get down again in the area into the location without too much increased pain, and you roll for about 5 days to 7 days. Somewhere there, if you roll about 3 times a day for that 20 to 30 seconds, you should start to feel a release in tension in the area, as in it doesn't become and it's not as hard or as uncomfortable as when you start, and you should start to notice a reduction in that back pain, if indeed it's coming from those muscles. If you don't receive or feel a difference in that amount of time, a couple things can be wrong. One, we are probably not getting right on the tissue that we need to. We're not pushing deep enough on there, or we're not doing enough time. It may need more like 40 seconds to a minute, and maybe 4 times a day. If you change all of those and keep doing it and still don't notice any change, after a few 3 days after that. And there could be some deep-rooted trigger points that cannot be reached by foam rolling, and or there could be compensatory stabilizing or moving patterns in the pelvis and hip that keeps irritating and bringing tension into that muscle. So it's like 2 steps forward, 2 steps back scenario. At that point, you'll need to seek professional help by coming and seeking treatment with one of our great doctors here at Integrated Health Solutions, such as myself. On the flip side, if you start to roll and it's very uncomfortable after the first day, you're very sore the next day and the next day, then you need to cut back. Out of time, maybe cut down to once or twice a day, maybe 10 seconds. If that still is very uncomfortable and increases pain, definitely as you keep doing it, you just stop. The amount of stress and strain that it induces there is too much for the body to handle right now, and it needs to be reduced down from professional help first before going back and rolling, or utilizing more gentler techniques in that area. Once again, by seeking help from us, one of the doctors here at Integrated Health Solutions, we can help you through that. Find the right necessary level of stimulation rolling that's appropriate for your condition, as well as releasing those deep trigger points that are hard to get to you from rolling to provide you that relief via a myriad of techniques. So grab your foam roller, get working on those muscles so that you can enjoy more sitting at work. And if you need extra help, if you're not getting it here with foam rolling, please seek us out by going to www.ihsne.com and schedule your appointment online with one of us today, and we'll get you the help you need to get your back and enjoy sitting again. Thanks again. Bye.